So definitely take advantage of that. The Elder Support Program is one of our more popular programs just because it is the catch-all case management, caregiver support, prescription drug assistance, transportation, all of the different issues that older adults face. And then we move towards some of our programs that really deal more with vulnerable older adults and incapacitated seniors, nursing home, our nursing home ombudsman program, which is the program that's actually going to be impacted by this donation drive of the SOGs. It's actually federally mandated that nursing homes have what's called an ombudsman, which is kind of a funny word, but it basically just means an advocate. That there's somebody responsible for seeing that nursing home residents have quality of life and have care and receive proper attention. Sadly, this does not happen without an outside person coming in. We're responsible for Dallas County. There are 68 nursing homes in Dallas County. And the statistic is that 50% of nursing home residents don't receive a single visit by a friend or a family member in a year. Think about that. Think about, we're coming up on 4th of July. So last year, what did you do 4th of July? Think about your activities, and then think about everything that you've done since. And imagine being in a small room, and the only people who've interacted with you are people who are paid to take care of you. That is a huge problem. And so having this sock drive and taking that out to nursing home residents and letting them know that there are people who care about them. There are people who are generous in spirit and who want to make a difference even at that point in their lives. And so our nursing home ombudsmen go out to nursing homes and make regular unannounced visits. We go in, we talk to residents when they're able to talk. If they're not able to talk, for some they have dementia. For some, they have health problems that prevent them from communicating. And especially in those cases, we want to be out there and using our observation to see what's going on. Are there problems? Is there something that we can address with the administration there at the nursing home? And we've gone out. We typically handle about 600 complaints a month. And these range from call lights not being answered. We've gone into rooms and the call light has been tucked behind the headboard because it's a bother. Ms. Jones just keeps hitting that call button. God forbid she needs some assistance to use the bathroom, but staff are busy. So, going out, making sure that that's accessible, making sure that that call light is answered in a timely manner. We've been out to homes where there's insects crawling, and imagine if you're not able to get up and your call light's been going off for 30 minutes and nobody has come in. So it does seem like the residents who have family members coming in, and there are some who do have family and people who really care and come out on a weekly basis or a daily basis even. Those are the people who get good care, typically. If you're staff and you're short-staffed, you're paid barely minimum wage, and there's somebody who's going to complain, family members who are going to complain if your loved one doesn't get attention, and then there's somebody here who nobody has been to visit in 8 months. Those two call light buttons go off, who's going to get the attention first? So that's one thing that we always advocate, and we have people who contact us when they're looking at situations where they need to choose a nursing home. Sometimes that really is a necessity for families, and so we can help. We can't select a nursing home for a family, but we can tell you this is what we see when we go out to that nursing home. These are the issues. And just give you our opinions of and our encounters and interactions with nursing homes to see which one is going to be a better fit for you. And we're very happy to provide that and be transparent and share that information with people. But we always say, be visible, have a presence in the home. And for the people who don't have anyone to be a presence, that's why we're there week after week, month after month, and really just making sure that concerns get addressed. And if we can't address them to the resident satisfaction, then that's where the state is called in. And we've had situations where, there's theft and abuse, sexual assault, all of these things, crime that occurs out in the community also occurs in the nursing home. And so, when it's bumped up to that level, then we'll call the state in and the state will come in and address that. But I'll tell you, that is probably one of the programs that I am most connected to emotionally, just because you immediately see the impact that you have when you go out to residents and you visit with people. And I'll never forget one of my first activities. I actually, when I was in graduate school working on my master's in social work, I did an internship with the Ombudsman program. Here I knew, in the field, had not really worked with older adults a lot. My prior experience had been with domestic violence and working in support group settings and working with people children and families in domestic violence situations. So a little bit of a different group. Go into a nursing home resident's home, because their room, that is their home, and we want to treat it as such and be respectful. Went into her home and asked if there was anything that I could do, and she asked me to sit on the bed, and so I sat down beside her, and I have my paper and my pen and I'm ready to solve her problems. And I said, what can we do for you? And she said, honey, if you'll just sit here and just hold my hand. Oh, I couldn't help it. I teared up, and so I just sat there for probably, 10, 15 minutes. She didn't want to say anything. She just wanted that contact. And so that was a really important lesson for me. Just meeting people where they are. And it's not about meeting the needs you think that they have. It's about meeting the needs that they